Good morning, everybody, and welcome to the Subcommittee on Oversight Investigation on Import Safety and the Status of FDA's Screening Efforts at the Border. My colleagues, today the Subcommittee on Oversight Investigation will examine the status of the Food and Drug Administration's effort to ensure that Americans have access to the safest and highest quality imported food, drugs, and medical products. This subcommittee has a bipartisan tradition of periodically meeting with and demanding accountability from the federal officials tasked with screening imported food and medicines that the American people increasingly rely on for their health and quality of life. As Commissioner Hamburg herself noted in her February 2010, FDA-regulated products are currently imported from more than 150 countries, with more than 130,000 importers of record and more than 300,000 foreign facilities. This hearing marks Commissioner Hamburg's first appearance before our subcommittee since her confirmation. Since assuming her current position, the Commissioner has touted a vision for FDA to serve as a, quote, truly global public health agency. In her own words, the FDA, quote, the FDA faces a daunting set of tasks. Globalization has multiplied the scale of our responsibility and the challenges that we all face. I applaud the Commissioner's expressed support for a number of important FDA initiatives. Our concern this morning, however, is less with what has been promised and more about what has been achieved in the interest of public health. For example, in a February 2010 speech, the Commissioner unveiled a new program developed over the previous decade, enabling FDA for the first time to comprehensively and intelligently screen all food, drugs, and medical products that are entering the United States. This system, known as PREDICT, which is short for Predictive Risk-Based Evaluation for Dynamic Import Compliance Targeting, is a cutting-edge, risk-based tool that could help reduce our vulnerability to poor quality imported food and counterfeit or otherwise prohibited pharmaceuticals. However, despite promises to begin deploying it nationwide by late 2009 and have it fully up and running by the spring of 2010, PREDICT has only been deployed in 3 districts over the last 14 months. At this rate, it would take FDA over 5 years to deploy PREDICT in the remaining 16 FDA districts. FDA has informed committee staff that the technical glitches holding up PREDICT's nationwide deployment have been resolved, and that FDA anticipates deploying the system to Florida and Puerto Rico by the end of this month. If the technical issues have been resolved, why does FDA continue to deploy PREDICT in such a piecemeal manner? I don't see any reason not to push more aggressively for its immediate deployment nationwide. I also expect to have the Commissioner back here before the committee at a future time to comment on the progress of PREDICT's deployment. Serious vulnerabilities in our import screening system do remain. For example, millions of parcels arrive by international mail and express courier facilities every year. PREDICT is not deployed at any of these facilities presently, nor am I aware of any plans for PREDICT to be used in these settings. FDA must treat each and every one of these parcels just as it does imported cargo shipments, as potential carriers of dangerous tainted foods and adulterated or counterfeit drugs. FDA cannot claim to be doing all it can to protect the American people from these threats so long as a major entry point for goods into this country remains largely unmonitored. FDA also should not overlook the threats posed by rogue internet pharmacies that falsely market their products as Canadian in origin. A recent 60 Minutes CBS report on counterfeit drug import featured a senior FDA official admitting that his agency lacked the authority to destroy dangerous shipments and was forced to simply return them to the sender. This report highlighted a serious and frustrating problem with our current screening process. We need to better protect the health and safety of all Americans. In March 2007, FDA learned that melamine, contaminated vegetable proteins imported from China and found in certain pet foods, were sickening and killing cats and dogs. Also, the Commissioner noted on 60 Minutes that over 80 Americans died in 2008 as a result of contaminated heparin and a blood thinner which had also been imported from China. The Commissioner suggested earlier this year that, quote, regrettably, another public health crisis like heparin or melamine seem inevitable, end quote, unless certain changes are made in our import screening process. We cannot and must not accept this inevitability. PREDICT is the most promising tool we have to enhance our defenses against such a threat. Let's deploy it nationwide and without further delay. So, Commissioner, I look forward to discussing with you the possibilities of legislation or perhaps legislative report language to help provide more focus and support to the deployment of PREDICT and other improvements to FDA's import screening. Let me welcome our witness, Commissioner Hamburg, and I will now yield to the ranking member, Ms. DeGette from Colorado, for the purposes of an opening statement.
Thank you so much, Mr. Chairman. I'm very pleased that we're having a hearing today about the safety of imports regulated by the FDA. I think that the FDA plays a vital role in protecting the health and security of Americans, and I know we'll have probably many oversight hearings about this role over the next couple of years. Although I'm really happy to see Commissioner Hamburg here before us today, though, Mr. Chairman, I'm dismayed that out of 3 of the last 4 hearings, the majority has denied the minority a witness. And this approach is inconsistent with the practice of all the other subcommittees on this committee in this Congress, and frankly, it's inconsistent with the practices of this committee in previous Congresses. In the case of today's hearing, we requested testimony from Alan Kokel, Director of the Pew Prescription Project. Mr. Kokel is an expert on issues raised by the influx of imported drugs and other medical products, and his testimony would have enhanced our understanding of this matter. So I ask unanimous consent to put his testimony in the record, Mr. Chairman.
By unanimous consent, so ordered.
Thank you so much. Over the past decade, imports of FDA-regulated products have grown at an astronomical pace. In 2004, the FDA oversaw the entry of 12 million shipments of products like food, pharmaceuticals, and medical devices. In just 6 years, the number of imports nearly doubled, reaching 21 million shipments by 2010. And the number of imports is expected to grow. Unfortunately, the FDA faces resource constraints that pose significant challenges to the agency's ability to keep the food and drug supply safe. For example, the FDA is able to physically inspect less than 2% of imported shipments. In the face of such challenges, the FDA has worked hard to become more efficient. One example of this is the creation of the PREDICT database system. This system enables the FDA to target higher risk shipments for inspection, enhancing FDA's ability to ensure the safety of imported food and drugs at ports of entry into the U.S. The system is currently in use in New York, Los Angeles, Seattle, and San Francisco, and soon it will be implemented nationwide. So given the increasing number of imports and the resource constraints facing the FDA, it's difficult to understand why we would be cutting FDA funding. In H.R. 1, for example, which was the majority's opening salvo in the budget debate, the Republicans proposed cutting FDA's budget by $241 million. The Republicans' fiscal year 2012 budget, recently introduced by Representative Paul Ryan, calls for massive reductions, rolling back the agency funding to 2008 levels. In FDA's case, this would mean a budget cut of over $600 million, a nearly 20% reduction in the agency's total budget. So make no mistake about it, a cut of this size would have a significant a significant impact on the FDA's ability to keep the food and drug supply safe. We're going to be voting on this budget this week, and I'm hoping that we can reconsider these devastating FDA budget cuts. Even once PREDICT is implemented nationwide, it is not going to substitute for the budget that the FDA needs to have to undertake its oversight responsibilities. Mr. Chairman, as you so accurately noted, in the last Congress, we took an important step forward regarding food safety, passing the Bipartisan Food Safety Modernization Act, which gave the FDA new tools to protect the safety of the nation's food supply. Now we have an opportunity to provide the FDA with additional resources and authorities it so desperately needs for pharmaceuticals. Nearly 40% of the pharmaceuticals in this country are imported, and up to 80% of the active ingredients in drugs come from foreign sources. The Drug Safety Enhancement Act, introduced yesterday by Mr. Dingell, will hold manufacturers responsible for the safety of the entire pharmaceutical supply chain, including components produced in foreign countries. And it will give the FDA tools it needs to enforce these requirements. This is good legislation that deserves bipartisan support. Mr. Chairman, there's a lot of ground to cover in today's hearing, and again, I appreciate Commissioner Hamburg for coming today. I'm looking forward to hearing about the FDA's efforts on imports, about the PREDICT database system, about its work implementing the new food safety law, and its views on the Drug Safety Enhancement Act. And I hope that we can work together to explain why budget cuts to the FDA right now are not the way to go in order to protect our nation's citizens when it comes to drugs and food. Thank you.
I thank the gentlelady. I'm just a little puzzled because I thought the National Journal just reported the FDA got a $107 million increase. So we have, maybe our figures are different. And I would also say to the gentlelady, the Honorable Hamburg is really the administration witness. Probably the Republicans could argue that.
You know, if the gentleman will yield.
I'll be glad to yield. I mean, we can almost request our witness because she is really more or less your witness. And as you and I talked earlier, that we want to concentrate on this PREDICT model, and she's the only one that could do it. And we just want one panel, and she's the top person. I yield to you. Go ahead.
Yeah, you know, this was the same thing, Mr. Chairman, that you told me the last time you denied the minority witness when you called the administration in to testify. So I talked to our Chairman Emeritus, Mr. Dingell, about this, and I said, you know, when we were in the majority and we called an administration witness in when the administration was of the other party, did we allow the minority witness? He said, yeah. If someone calls a witness, it doesn't matter if they're a Democrat or a Republican. The fact is the minority retains the ability to call witness.
Well, we'll
in the case of the hearing today, the witness we would have wanted to call would have actually helped us understand this PREDICT system.
Okay, I think the Honorable Ms. Hamburg seems very confident and capable of handling us all by herself. With that, I'll recognize Chairman Emeritus Mr. Barton from Texas for 2 minutes.
Thank you. Well, I want to congratulate you and Ms. DeGette. You at least got an administration person to come. We have a hearing upstairs where apparently everybody at EPA is on vacation. So I want to give you two credit. You have our distinguished commissioner, and I am absolutely certain that she's going to be able to handle any questions either group of us pose to her. We do welcome you, Madam Commissioner. You've got a very difficult job, and we're always glad to hear your input. This is an important issue. It's not on the front pages right now, which is a good thing. In the last 3 to 4 years, we've had several food poisoning situations that have made the front pages, so it's good to hold a hearing in a non-crisis situation. We all know how much of our food is being imported, how much of our medical devices, how many of our pharmaceutical finished products and precursor ingredients. So how the FDA regulates and inspects these products is extremely important. This is an area where there has been bipartisan support in the past. Chairman Dingell, Chairman Waxman, myself, Chairman Upton have all in the past 6 years worked together to improve our food system and improve the screening process. I'm going to be very interested in your comments on the PREDICT model. I know that it's being used now in 4 locations or 4 regions. Would like to know why perhaps we can't go ahead and implement it nationwide. So, Mr. Chairman and Madam Ranking Member, this is a good hearing. Hopefully it will be bipartisan in nature, and we will put the facts before the American people. With that, I
thank the gentleman and recognize the gentleman from Texas, Dr. Burgess.
I thank the
for
chairman.
2 minutes.
Thank the chairman for the recognition, and I will just mention to the gentlelady from Colorado, the ranking member of the committee, that I will support her efforts to have a full and open hearing on the heparin issue. I tried to do that when I was ranking member of the minority, and then Chairman Waxman refused those entreaties. I was fortunate enough to get a briefing by Dr. Hamburg in my office, but nothing substitutes for a full and open hearing so the American people can actually hear what's going on. Now, the Food and Drug Administration is truly at a crossroads of the issues that really impact our country today and will shape tomorrow, from the food on our tables today to the cures, the drugs and devices that our nation's doctors will offer the patients of America. The ability of tomorrow's doctors to alleviate human suffering is going to be something on a scale that none of us have ever seen before, if they can get through the FDA, and your agency commissioner is obviously at the forefront of those battles. This committee, with its oversight of food and drug, is responsible for maintaining an active dialogue with you on the full breadth of your jurisdiction to ensure that you have the tools that you need, but you are using them in a way that is beneficial for the country at large. Primarily, this hearing today will focus on food safety, and I've been concerned about that for years. In 2007, I introduced legislation that would give the Secretary of Health and Human Services the power to refuse admission to a food that was strongly associated with a suspected foodborne illness. We all remember the Lou Dobbs reports from a couple of years ago when contaminated tomatoes were quarantined in Texas and Georgia and Florida, and it turned out these were peppers coming across the border. It was found on a Friday afternoon, and nothing could be done until Monday because, after all, it was the weekend. We got to be able to stop that stuff when we find it. When there's a known source of contaminated food, you should be able to act without wasting time. Now, we all know that we knew this year, that coming into this year, that another salmonella outbreak was going to happen. We passed a food safety law last year. We have increased the FDA budget. So I am interested in, do you have the tools you need with the new legislation that you have, the budgetary allowance that you've had? Now, Dr. Sharfstein came in and said you needed no more money for drugs and devices. So I'm assuming you've put a lot into food safety, and we do want to know what is going to be different this April, this May, this June than previous years when this inevitable salmonella outbreak occurs. I thank the chairman for the recognition. I'll yield back my time.
Gentleman yields back. The gentleman from California, Mr. Bilbray, is recognized for 1 minute.
Thank you, Mr. Chairman. Mr. Chairman, I come from a state where you can't talk about health without talking about holistic issues, too, and the interrelationship between components, that nothing in health is isolated. One of the things that is quite obvious that we are not going to specifically address today, but I think that we all have to be aware of, that the reality of what is happening with our the development of drugs and the production of drugs in this country, this issue of importation is going to grow dynamically. Literally right now, you have companies that are leaving this country in droves and going overseas to not only produce the drugs, but also the research and development. And I just think this committee needs to just be aware that this issue may be reduced, may be increasing substantially, basically because we're seeing the next generation of innovation and drug development literally leaving the country. And sadly, the fact is that things like drug manufacture and research doesn't take a lot of time to leave the country and evaporate as much as, let's say, auto manufacturing. We're seeing that going. So this issue is going to grow. The one place where it's going to probably be reduced by this crisis is the reimportation. And that is something we need to talk very openly and frankly about. The assumption that that something claims to be being reimported, so it's not reviewed, there's no oversight. As somebody who was born and raised along the border and seen what happens across the largest port of entry, land port of entry in the world, the Tijuana, San Diego port of entry, this is obviously something that's very near and dear, not just to my constituents, but to my family. And I think that we need to address those issues and really talk about them extensively. But I just think that as we look at this, we've got to be aware of the crisis coming down the pike and address that with this. Thank you very much, Mr. Chairman.
Thank you, gentlemen. The gentleman from California, Mr. Waxman, the ranking member, is recognized for 3 minutes.
Mr. Chairman, this is the 4th oversight hearing, and 3 out of the 4 we've been denied minority witnesses. I want to join Mr. Gedd in complaining about it. Representatives of this administration are not minority witnesses. They represent the other branch of government. And we're going to have a serious talk about this. This isn't the way this committee is operated when the Republicans control the committee or when the Democrats control the committee in the past.
May 6th.
FDA's ability to protect the American public is an important topic for oversight, and our witness would have added to that understanding of this hearing. FDA is responsible for ensuring the safety of food, drugs, and medical devices, and if FDA does not do its job, lives are at stake. In the official memo hearing memo for today's meeting on the safety of imports, the right questions were posed. What are FDA's solutions for enhancing the screening of imported food, drugs, and medical devices? What is FDA doing to improve its IT infrastructure for risk-based screening? How can FDA better ensure the safety of imported products? But there's an enormous disconnect between these questions and what is happening in Congress this very week. GAO reported, told us that improving the safety of our food and drugs requires that we provide FDA with more funding and resources. Yet we're doing the exact opposite. Just like last week, Representative Paul Ryan introduced the Republican budget for fiscal year 2012. The House will soon be voting on this proposal. There's not a lot of detail, but there's enough to know what it would mean for FDA. Republicans propose to roll back discretionary funding for all agencies to fiscal year 2008 levels. In the case of the FDA, the agency budget would be reduced by $600 million, a budget cut of almost 20%. This budget would require a dramatic reduction in FDA's funding to keep the food and drug supply safe. The result would be the reverse of what the American people want: fewer inspections and more adulterated and dangerous food and drugs. Mr. Chairman, there's a word now, I think part of the American language, called chutzpah. It means you got a lot of nerve. And I think the Republicans have a lot of nerve to haul the FDA commissioner up here and grill her about what FDA is not doing more, why FDA is not doing more to keep the food and drug supply safe, while simultaneously passing a budget that takes away the resources she needs to do her job. It's chutzpah as well for the Republicans on this subcommittee to complain that FDA is not doing enough about food safety when the majority of the members on this committee voted against the Food Safety Modernization Act, which was the first expansion of FDA's food safety authorities in 70 years. Commissioner Hamburg, I'm pleased you're here. We appreciate your being here. You were not here at the request of the minority. It would be ridiculous to have this hearing without you. Mr. Chairman, I want to yield the rest of my time, 2 minutes, to Mr. Dingell, who has been instrumental in the food safety and drug and medical device safety questions. And it's important that we hear from him. And I'm pleased you're allowing him to be
2 minutes.
Given open.
Mr. Dingell.
Thank you. I thank my good friend from California for yielding me this time. I commend you for having this hearing because it is a great opportunity for us. I think for us to spend time caviling over whether a witness is a Democratic or a Republican witness is a prodigious waste of time. This committee has a fine history of having worked together to put out good legislation that includes the food safety legislation in the last Congress, also the wonderful legislation we put together over the question of Consumer Product Safety Commission and giving it the authority. Americans suffer from unsafe pharmaceuticals coming into this country. They have neither the personnel nor the money to do the job that we need to do to catch these things coming in. They function under inadequate law, which does not enable us to seize the products coming into this country and to destroy them, and rather they are turned around, sent out, and come back in through another port. Americans are dying of this. They're being denied proper prescription pharmaceuticals in order to address the problems that they confront in terms of dealing with major problems like cancer, heart, hypertension, and other things that are killing Americans. Yesterday, I introduced with my colleagues, ranking members Waxman, Pallone, and DeGette, H.R. 1483, the Drug Safety Enhancement Act. This legislation would require manufacturers to implement improved quality and safety standards, including stronger supply chain management, a matter often the concern of my Republican colleagues. It would require manufacturers to notify FDA of counterfeits or safety concerns and to list drugs and components by the country of origin. It would enable us to track the movement of these pharmaceuticals as they move through commerce. It would strengthen importers and customs brokers' oversight. It would arm FDA with administrative detention, destruction, and mandatory recall authorities, subpoena power, and clear extraterritorial jurisdiction. It would strengthen criminal and civil penalties for crime deterrence, and it would increase foreign manufacturing inspections to be on a par with those that are suffered by American manufacturers. It would also create new funding mechanisms for FDA inspectional activities so that globalization is not going to burden American taxpayers. I have an excellent article about the safety problems that we confront, together with an analysis of the legislation, H.R. 1483. I ask unanimous consent that those be
Unanimous consent, so ordered.
And I commend you for this, Mr. Chairman. You are leading an effort which I believe can bring great good to our people.
And I thank the Chairman Emeritus and his long serving as the former chairman of this committee. And I would point out, I asked staff, based upon what Mr. Gett and Mr. Waxman indicated, that last year, under Democrat majority, they had a hearing with only the FDA commissioner on May 6, 2010. So I think at this point,
Mr. Chairman, will you yield to me? This is kid stuff.
Well, no,
I don't know if you requested a witness or not. If we request a witness who we think adds to it, it's going to be 5 minutes more out of your life to hear from that witness.
All right.
And I think it's very narrow and mean-spirited to try to deny us even opportunity to hear witnesses that we think could add to the hearing itself.
Well, I appreciate your sentiments. I just don't agree with you. Okay, with that, we're very pleased to
rules that require it if that's the way the chairman wishes to deal with it.
We welcome our witness today, the Honorable Margaret A. Hamburg, medical doctor, Commissioner of the Food and Drug Administration. If you don't mind, just turn your speaker on and move the speaker a little closer to you, and that'd be very helpful. I have to swear you in, so let's see. Stand, raise your right hand. You swear to tell the whole truth and nothing but the truth, so help you God. You are sworn in. Thank you. We welcome your opening statement.
Thank you very much, and good morning, Chairman Stearns, Ranking Member DeGette, members of the subcommittee. I'm Dr. Margaret Hamburg, Commissioner of the Food and Drug Administration, and joining me here is David Elder, Acting Deputy Assistant Commissioner for Regulatory Affairs for Field Operations. He's been with the agency for 23 years, 15 of which he spent in the field. I appreciate the opportunity to be here with you to discuss our approach to import safety and the predictive risk-based evaluation for dynamic import compliance targeting application, or PREDICT, and its role in our efforts to protect our nation's supply of food and medical products in an increasingly globalized market. When President Franklin Delano Roosevelt established the modern FDA back in 1938, the percentage of food and medical products imported into the United States was minimal. Today, the landscape, as you've already been discussing, is dramatically changed. FDA-regulated products are currently imported from more than 150 countries. This year, we expect that nearly 24 million shipments of FDA-regulated products will arrive at U.S. ports of entry. It's estimated that between 15 to 20% of all food now consumed in the United States originates outside our borders. Further, up to 40% of the drugs Americans take and up to 80% of the active pharmaceutical ingredients in those drugs come from foreign sources. We face great challenges in ensuring that products are high quality and travel safely throughout their complex supply chains. As members of this committee well know, our concerns are not purely hypothetical. The consequences of adulterated medical products throughout the world have already been noted, and they've been tragic. Pet food adulterated with the industrial chemical melamine in 2007 sickened several thousand pets here in the United States, and that same contaminant was added to infant formula in China, fatally poisoning about 6 babies and making 300,000 others gravely ill in that country. And members of this committee are well aware of the 2008 heparin contamination crisis, in which adulterated heparin was associated with several deaths and cases of serious illness. To address these threats and others, we need a paradigm shift in our approach to import safety, where the border is no longer our primary line of defense. We must partner with industry and our global counterparts to push responsibility for safety and quality further up the supply chain and to monitor the integrity of that supply chain throughout. That is why FDA is developing a global strategy and action plan more fully detailed in my written testimony, which will allow us to more effectively oversee the safety of all products that reach U.S. consumers in the future. While we cannot simply be guardians at the gate, border screening, surveillance, and intervention must remain an important part of our comprehensive import safety program. The task is enormous. In fiscal year 2010, FDA received a total of 21.2 million lines of FDA-regulated commodities imported from over 150 countries. FDA is currently managing 264 active import alerts, which flag potentially high-risk imports representing 3,100 types of products from over 11,000 manufacturers in 150 different countries or areas. To help make our import screening more efficient, FDA has developed the PREDICT application, a sophisticated information technology system which provides FDA staff on the front lines with more information regarding the many risks associated with products entering our borders and allows them to target for examination those shipments at greatest risk. PREDICT has been launched in Los Angeles, New York, Seattle, and San Francisco, covering about 40% of all imports at the present time. Some technical difficulties, as noted, delayed our national rollout. However, I'm pleased to report that we've addressed those issues and are back on track. This month, PREDICT will be implemented in our Florida and San Juan districts, expanding coverage to almost 50% of all imports. If successful, it will then be rolled out across the country. PREDICT is an exciting and important innovation that harnesses advances in information science to enable us to do our job better and to improve our service to the nation. But as I mentioned earlier, it's just one step in our efforts to fully secure the supply chain. Congress has provided the agency with critical tools to assure the safety of imported food. New regulatory authorities for drugs similarly may help ensure that we can hold industry accountable for the security and integrity of their supply chains and the quality control systems they use to produce drugs for the American people. Those may include authorities in the areas of corporate responsibility, enforcement, and information sharing, which are detailed more fully in my testimony. Thank you for the opportunity to testify this morning, and I look forward to answering your questions.
Thank you, Commissioner Hamburg. We have a clip we're going to show on the screen here. It's from a speech you gave in January discussing the FDA's new global challenges. If we can, play the clip. Maybe just drop the lights a little bit.
Growing challenges. Regrettably, another public health crisis like heparin or melamine seems inevitable unless we are able to truly forge changes in how we ensure the safety and quality of food and medical products for our citizens.
That statement indicates that you believe the current threat is pretty serious, and you have spoken repeatedly about the challenges assuring the safety and quality of imported products in a global age. You mentioned that in your opening statement, and I think we can conclude, obviously, that import safety is one of your top priorities, and you have promoted PREDICT as an important tool to leverage FDA's resources in responding to this global challenge. That's correct. As you mentioned in your testimony, you formally unveiled PREDICT in February 2010, a speech, and you stated that you hope to have it up and running nationwide by the end of the spring of 2010, as we recollect. I guess the question is, what did you do to try and accelerate the implementation of the process, considering you had indicated that you thought it'd be up and running by the spring 2010?
Well, as noted, PREDICT is a very important tool that will enable greater efficiencies in how we target resources, and it is very exciting to see it now in action in 4 of our districts and covering about 40% of all imports at the present time. As we rolled it out, from the very beginning, it was determined that it should be done in a systematic, stepwise way, because very often with computer system implementations that involve extremely large databases, there are issues that emerge in the process. So we began in one location with a limited focus, expanded the focus, and then began to roll it out. In the course of that, unfortunately, some issues did emerge, and we actually, at a certain point, decided to stop with the actual use of PREDICT in the field while we brought in experts and put together a team within the FDA
So really, in a
to
sense,
examine that.
rather than trying to accelerate the implementation process, you really stopped it then.
Well, what we did was when problems
isn't that
emerged
true?
in its implementation, we stopped it in order to identify what those problems were, rather than keeping a system.
Let me
that
get a
wasn't
little more
working.
specific for you. After PREDICT was deployed in the New York district in the spring of 2010, there appeared to have been a 5 to 6 month delay while a government contractor wrote a white paper on a performance assessment of PREDICT. Given the import safety is one of your top priorities, I guess our question is, why is this delay? Is this the delay of this deployment acceptable, considering how important it is? And you said earlier in your speech and everything that this has to be enforced.
Mr. Chairman, I understand your concern about an unfortunate delay that occurred in the process. However, this system is very, very important. It's critical that it work effectively and efficiently. We had identified problems with its implementation. We stopped the full rollout while we brought in outside experts and our own internal experts to identify the source of the problem. The effort that you mentioned was an effort to identify the source of the problem.
Can I say this morning that all the technical problems have been solved?
We believe
Unequivocally?
that we have identified the underlying problem that led to the,
so the answer is yes.
inefficiencies in the system.
The answer is yes, that you think all the technical problems have been taken care of.
It seems
Mr.
to
Elder,
be
is
now
that true?
functioning very well in
Okay.
the sites where it's present. We
Can
plan
you, based
to,
upon that, make a prediction this morning that PREDICT nationwide will be fully implemented by the end of the year? Is that a safe?
That is our absolute goal, but if there are problems in the implementation, we will, of course, examine those and correct them. But we are moving forward. We see no barriers to the further implementation of PREDICT in the 2 additional sites.
Okay.
At the end of this month, and extending it to 100% implementation by the end of the year.
In your opinion, wouldn't PREDICT benefit from a program-focused oversight structure with executive-level involvement?
I'm sorry, would it benefit from an oversight structure?
A more focused approach with more executive-level involvement instead of you having these technical white papers. Can't you just have your staff focus down on this and bring in sort of the executives to make decisions?
You know, I feel that we have been implementing this in a very responsible way with a clear program plan, with internal and external experts overseeing the project. When problems emerge, we've taken the appropriate actions to remediate them. We now have the system up and running in the desired way, providing benefits.
Well, right now,
these products.
Right now in Congress, I guess the question is, do you think you need congressional support? Should we pass legislation that's specifically authorizing this program and working with the Appropriations Committee to include report language? I mean, would that help you at all, or do you think that is not necessary?
The continuing support of Congress for our efforts to support import safety are extremely welcome. I don't think we need targeted legislation or activities for the PREDICT program. As I said, I believe that it is moving forward in an appropriate and valuable way, and that it was our responsibility as problems emerged to identify the source of those underlying problems, fix them, and make sure that the program in place, in fact, was fully functional and able to do the tasks that we're asking it to do. And it is proving to be of great value as we screen products today.
My time has expired. The gentlelady from Colorado is recognized for 5 minutes.
Thank you, Mr. Chairman. So, Dr. Hamburg, let me get this straight. It was about 14 months ago, February of last year, that the FDA announced this PREDICT program, right?
When I, in the speech that you saw the segment of, formally announced that this PREDICT
about 14 months ago,
was
correct?
going to start to unfold.
And then you started implementing it, and you found some problems, and so you had to correct those problems as the implementation went forward, correct?
That is correct.
And if you had just tried to implement the whole thing within 2 months, it's your view that it may not have worked because it had some problems, right?
It would not have worked.
Now, as of today, 14 months later, it's about 40% implemented, correct? And you need to use words. It's about 40% implemented.
4 sites that
Okay.
cover 40% of the imports.
Okay. And so is it the FDA's view that the major problems in the PREDICT program have now been solved by these efforts over the last 14 months?
It is our belief that through this systematic scale-up and the examination of problems as they emerge, that we've been able to correct the underlying problem in code, which actually wasn't in PREDICT, it was in an interface with PREDICT.
Okay.
And that now the system, is working in the sites that it's in place, and we see no barriers at the present time to the full implementation in a timely fashion.
And the FDA believes in this program and wants to implement it as quickly as possible, as well as us,
Absolutely.
right? So I join with Mr. Stearns in saying, whatever we can do to help you implement this, we think that it's important and it should be done as soon as possible, but it should also be done right. But here's my next question is you said in your testimony, PREDICT isn't the only thing we need to do. Why is that?
Because the volume of imports coming in at the borders and the number of sites of importation are so huge that the ability to really do the hands-on inspection, even with a screening tool like PREDICT, limits us in our reach. We want to reach back further, closer to where the products are actually produced and manufactured, and try to build in assurances of safety and quality from the very beginning and throughout the supply chain. So working more closely with industry in terms of the standards that are expected, working with sister regulatory authorities in countries around the world. So we have this harmonization of standards, sharing information with others.
And so let me ask you, because we passed the Food Safety Modernization Act last year, do you think that the FDA needs new authorities to begin to do what you're talking about and to protect the safety of the drug supply?
I think the Food Safety Modernization Act has clearly given us additional authorities and a new framework for addressing food safety in this context. I think we do need to very carefully examine the opportunities on the drug side as well. We know that there are huge challenges, and it was noted they are growing. We do need additional authorities to be able to do our job, and of course resources as well.
Yeah. One thing that I worked a lot on in the food safety bill that is also in the Drug Safety Enhancement Act is mandatory recall authority for the FDA for drugs. Do you believe this authority is necessary?
I do believe that authority.
And why is that?
So that we can move swiftly when there is an imminent threat to the health of the public, to take action, to make sure that a product with risks does not get out to consumers, is pulled back from shelves when it is out there. It's very vitally important, and our current authorities require us to either act through the authorities of states to embargo or pull back these products, or to seek the support of the courts in taking these actions.
You know, this is one thing. When I worked on mandatory recall for the food safety, my constituents were shocked because they thought the FDA already had that authority, and I bet that's true with drugs too. I bet people just think the FDA has that authority with drugs. One last question. One of the controversial areas in this new bill that we introduced calls for new registration fees on importers. I'm wondering if you can talk about what the FDA opinion is on these registration fees.
Well, I think it's very, very important that we recognize that the magnitude of the problem is huge and growing and outstrips available resources. Clearly, we need to bring appropriate resources to bear. Clearly, this is a responsibility that the American people care about, as well as industry, and I think it's appropriate that these programs be supported with industry contributions as well, and the ability to work with industry to achieve common goals in reducing these threats to health and safety will be, I think, enhanced in this kind of an approach.
Thank you very much. Thank you, Mr. Chairman.
Thanks, gentlelady. Dr. Burgess, recognized for 5 minutes.
Thank you, Mr. Chairman. Well, they can be enhanced in that kind of approach only if we understand the problem that we had and how to deal with the problem. And that, of course, brings me back to the heparin question, and you were kind enough to come and brief me last year in the last Congress. If I could, let me just recapitulate a couple of the things that we talked about that day. I would like to have them part of the committee's record. Can you provide to the committee a list of the people with whom you met in China, the Chinese officials with whom you met?
List of officials with whom I met while I was visiting China?
Yes.
I could.
Because you met with several.
For the record, I mean, I can't produce that
right.
now.
Correct, and I understand that. That's why I was asking if you could produce it for us. And did the subject of the adulterated heparin come up when you met with the Chinese officials?
It did. I raised it with them to express
They didn't bring it up spontaneously. You had to raise it.
I believe that I raised it.
Okay. And what did they commit to you as far as action to investigate and uncover what happened?
What was indicated to me was that they felt that there was not anything to be gained at this point by trying to continue the investigations of the underlying cause and instigators of the heparin contamination, but they did recommit to working with us to ensure that this specific problem and similar problems will not occur going forward. And we do have a memorandum of understanding with the Chinese government with respect to some of the critical public health measures that need to be in place and are in place to help protect.
See, that whole approach is problematic to me because now we have, with all good intentions, drug safety legislation being introduced, but we don't really understand what happened and how we're going to control it. And that then makes for legislative difficulties. But the heparin question is so fundamentally different from the melamine. Melamine could be argued was the equivalent of a dishonest grocer putting his thumb on the scale when he weighed your produce. But the heparin, this was a molecule that was developed specifically to defeat the mass spec test that was used by the manufacturer to document that, in fact, what they had extracted from the live specimen was the desired active pharmaceutical ingredient. So hypersulfated chondroitin sulfate would exactly reside within the peak that normal heparin would provide on the mass spec, and only when it was done with an ultrasensitive machine could you separate out and say, oh, there's actually 2 compounds here instead of 1. And that compound was patented under the Chinese system. So why was it created, and what possible use could it have had in a commercial application, and how in the world did it find its way in to contaminate the pharmaceutical supply chain? I mean, these are some pretty critical questions that need to be answered, and to just say, well, we're just going to, going forward, we're going to be sure things are done right. I'm sorry, maybe the heparin will be done right, but what was the intent here? Was it simply a dishonest retailer, or was there something more nefarious afoot? And we just simply don't know. So now you have the chairman emeritus and the ranking member writing legislation, which in all likelihood I could support in principle, but we don't know what we're trying to fix. We don't know how it happened in the first place. That's why we need your help. You were in China. You met with these officials. We need your help to understand how we do, in fact, prevent this from happening in the future. Would you not agree with that?
I agree that this is a very serious concern, and I agree that the heparin contamination was a very sophisticated example of a broader phenomenon, in fact, which you note, the economic adulteration of products. And I think it speaks to the urgency of our really strengthening the activities to ensure import safety, the importance of additional resources and authorities, the importance of stronger authorities to enable us to do investigations when there are problems.
Right, but it almost requires that we think like the criminal, because after melamine, melamine, shame on us, but heparin, why didn't we see it coming? Let me just ask you a question though, because this is so important that I get this in too. We're getting a lot. We've had a hearing from device manufacturers. We hear from drug manufacturers. There's a lot of complaints that the process that people have to go through with FDA to get drugs and devices approved is in fact at this point unknowable. And it makes the investment community nervous, and in fact it makes the investment dollars dry up, or worse yet, go overseas. So these drugs and devices are developed in other markets rather than the United States. So it's an outsourcing, it's an offshoring problem as well. What are you doing within the agency to ensure that those pathways can in fact be known before someone starts down, so that you can actually tell people what they will need to provide and then not change the rules of the game as they go through it?
You raise a really important issue, for our nation in terms of supporting innovation, critical industries, economic and global competitiveness, and FDA clearly has an important role to play. We are looking very carefully at our regulatory pathways and how we can be more transparent and predictable. Also looking at how we can bring the best possible science to bear so that we have better knowledge and tools and approaches to make the regulatory pathways more effective and efficient. We're working in partnership with academic scientists and industry science and government scientists to really try to strengthen the underlying science, because some of the problem with the regulatory pathway is in fact scientific uncertainty about how do you take a good idea and make it into a real world product. And of course, a bit outside of the FDA's bailiwick is the important question of what are the economic incentives to help ensure investments in important candidate products that hold real promise.
I think we'd both have to agree that the timeline is a strong economic disincentive. I heard from a physician who developed a product as he watched his son being circumcised and decided there had to be a better way to do some of these things. His son's going to college, and it's still tied up in the FDA. Thank you. I'll yield back.
Gentlemen, time has expired. The gentleman from Michigan, Mr. Dingle, is recognized for 5 minutes.
Mr. Chairman, I thank you. Commissioner, welcome. I want to focus on the nature of counterfeit and adulterated drugs that are crossing our borders. Some have said it's as much as $75 million a year. I think it's rather more. And recent scares like heparin and other matters show how much needs to be done to monitor imported drugs and pharmaceuticals. Now, having said that, recent reports by CBS News, more than 36 million Americans have unknowingly purchased drugs on counterfeit drug websites. Often these purchases are being dropped in the mail where they may not be tested either by Customs or Border Patrol. It's my understanding that under current law, if FDA recognizes counterfeit or adulterated drugs, FDA cannot detain or destroy products on site without going through a lengthy process providing notice and an opportunity for hearing, so that FDA instead often ships these drugs back to the sender. Is that correct?
That is correct.
So under current law, it's possible for a drug operation that's counterfeiting or adulterating drugs to receive, to put it in a package that was rejected by the FDA at one mail facility and to simply resend it through a different mail facility or again through the same facility. Yes or no?
Unfortunately, yes.
I believe I'm correct then in believing that if FDA had the authority to destroy drugs believed to be adulterated, misbranded, or counterfeited, that this would help to keep counterfeit drugs from re-entering our country through alternative mail facilities or other facilities. Yes or no?
That is correct.
Now, Section 201 of the Drug Safety Enhancement Act, which I introduced yesterday with my colleagues, Mr. Waxman, Pallone, and Ms. DeGette, would give FDA officers or employees the authority to order destruction. Section 202 of the bill would authorize the destruction of any drug valued at $2,000 or less, or that the Secretary deems to be a significant adverse health risk. Anything valued at more than $2,000 could not be destroyed until a notice and opportunity for hearing occurred. Do you believe having this authority would discourage counterfeit drug operations from shipping their products into the U.S.? Yes or no?
Yes.
Now we know that these counterfeit and adulterated drug operations are a lucrative business. These operations make money out of the pockets of consumers who may not know that their prescriptions are either unsafe or ineffective. I believe that we must impose severe penalties, at least equivalent to similar violations relating to different kinds of products, so as to discourage their continued operation. The legislation introduced yesterday proposes strengthening civil and criminal penalties for any person who knowingly distributes unsafe pharmaceuticals. Do you believe that criminal and civil penalties discourage the counterfeit and adulterated drug operations? Yes or no?
Yes, I believe they would.
Now, Commissioner, the Drug Safety Enhancement Act would also require FDA to inspect every establishment, foreign and domestic, at least once every 2 years following registration. You at FDA have been continuously and chronically underfunded. Personnel from FDA have said publicly that FDA's resources do not keep pace with the volume of products coming into the U.S. The majority proposed 2012 budget cuts $600 million from FDA in spite of the fact that new safety authorities for food safety that you are required to implement. Would you agree that a fee system could help provide a stable funding source for drug safety activities? Yes or no?
I believe we need additional resources to do the task before us.
Would you support such a fee system, Commissioner?
Pardon me?
Would you support such a fee system?
Yes, I would.
Now, can you give us an appreciation of how many people you have in charge of dealing with imports of pharmaceuticals? You don't have to tell us this morning. Submit that for the record. Would you also submit to us how much that costs? And would you submit to us how many people you need to do this work and how much that would cost, please?
I'd be delighted to put that together and submit it for the record.
This committee, going back as far as when I was chairman of oversight, used to have people in to discuss these matters, and we never got around doing anything about it. Last year, we passed by overwhelming vote. It came unanimously out of this committee, if my memory serves me correctly, the food safety bill. Is that working well?
We're still very early in the implementation, but it is a huge contribution, a historic shift really in how we are able to address food safety issues, giving us a new focus.
It gives you lots of new and needed authorities.
It does.
And you recognize many of those authorities in the pharmaceutical safety bill introduced yesterday, do you not?
I think we would like to see parallel authorities in the drug area in many key arenas.
Mr. Chairman, I thank you for your courtesy to me. I hope that we will be able to use this hearing as a mechanism to move forward towards safety of our people from bad pharmaceuticals as we have done with regard to bad food safety. And I would hope my colleagues will work with me in a bipartisan fashion towards this end. Thank you, Mr. Chairman.
I thank the gentleman. Dr. Kingery is recognized for 5 minutes.
Mr. Chairman, thank you. Dr. Hamburg, thank you for being here today and for your leadership at the helm of the FDA. I greatly appreciate your efforts and focus on efforts to encourage the FDA to adapt and improve its functions, including the use of the PREDICT software at our borders and ports of entry, and we appreciate that. Going to the PREDICT model, one that is flexible and able to meet new and emerging threats to our borders and ports. In many respects, I see the FDA reform in much the same light, and I think from your previous statements here, I know you do as well. Federal initiatives to develop new drugs and diagnostics, whether in the antibiotic space or elsewhere, can be greatly supported by an FDA that's flexible, adaptable to new technologies, and understandings of the human body and genome is critical. How important of a role do you think that the regulatory science, you've referenced that earlier, how important of a role do you think regulatory science can be to support the FDA in its work in the coming years and decades?
You know, I think it's enormously important, and I truly appreciate your question. It's an area of science, it's the knowledge and the tools that are needed to really effectively and efficiently evaluate a product for safety, efficacy, quality, and performance. And there have been huge advances in science and technology that can be brought to bear on the regulatory process as well as on the drug development and medical product development process to make it more streamlined and more modern, and will give us tools so that we can really shorten the time frame for the regulatory process in key ways, using innovative clinical trial models, using biomarkers to help us identify early concerns like toxicity.
Dr. Hamburg, thank you. And I think you know I'm currently working on some proposals in support of regulatory science and hoping that I can get your commitment. We'll sit down and work with me and my staff in support of this worthy goal. And
extremely eager
would
to work
really
with you,
appreciate that. Thank you, Dr. Hamburg. You expressed support for developing a track and trace and authentication system to help combat the counterfeit drugs. Can you update us on FDA's efforts in this area and give me your thoughts on the scope of drug counterfeiting and diversion in the United States? What else can we as a Congress do?
Well, with respect to the big picture, we know that counterfeit drugs represent a very large and growing problem. The burden is most pronounced in the developing world, where in some countries 30 to 50% of drugs for serious diseases being used, in fact, are not what they purport to be. It is a smaller problem in this country, in large part because we have a very strong regulatory framework, and we work very closely with counterpart agencies to minimize the problem. But with the growing complexity of supply chains and globalization, and the fact that we know that, especially in the absence of strong civil and criminal penalties, that counterfeiting is an increasingly attractive area for some bad guys, I'm sad to say. We cannot be complacent, and we need to make sure that we have the programs and policies in place.
Before the hearing started, I had spoke with you briefly about the 60 Minutes clip that I'm sure a lot of folks on both sides of the aisle saw recently, and the magnitude of the problem is downright scary, and certainly this is a timely hearing. Real quickly, in the last minute that I have, there have been some controversy related to the approval and subsequent price increase of a drug manufactured by KV Pharmaceuticals for the prevention of premature labor, and possibly premature birth. While not directly tied to import screening, it does involve FDA's mission to ensure the safety of efficacy of our nation's drug supply. And it was initially thought that pharmacies would be precluded from compounding versions of this product, which they had been doing for some time and selling for much less than the product marketed by KV. And because of the controversy that ensued, KV ultimately significantly lowered the price, and FDA announced that it would not initiate enforcement actions against the compounding pharmacies. I have a couple of questions in regard to that issue. Are you aware of any safety concerns with patients taking, excuse me, are you aware of any safety concerns with patients taking a compounded version of this drug versus a McKenna product?
As far as I know, we have not had reports of adverse events associated with compounding of this particular product.
And then the last thing, and I realize I'm a little bit over time, are any ingredients for the compounded version imported, as far as you know?
You know, I would have to get back to you. I honestly don't know the answer to that
And then
question.
real quickly, Mr. Chairman, I just wanted to ask you, Dr. Hamburg, in regard to Dr. Burgess's line of questioning about the heparin, have we then abandoned the heparin investigation? Is that pretty much over and done with?
In terms of the investigation of who actually instigated this economic adulteration of the heparin product, the investigations have come up dry and there are not active new leads. I think the other side of it that's important for you all to understand and the American people to understand is that we do have a very large number of steps in place and safeguards to protect against the importation of contaminated heparin if there were those who chose to try to begin again with this contamination of this important product.
Dr. Hamburg, thank you. Mr. Chairman, thank you for your indulgence. I appreciate
Illinois,
that.
Ms. Jan Schakowsky is recognized for 5 minutes.
Thank you, Mr. Chairman. Thank you, Dr. Hamburg. The job that you have taken is so expansive, from baby food to medical devices and everything in between. And I know that imports of FDA-regulated products have dramatically increased over the last 7 years. In 2004, FDA oversaw 11.8 million shipments of products like food and pharmaceuticals and medical devices. But by 2010, the importation of FDA-regulated products had nearly doubled, totaling in 2010 21.1 million shipments. That's a lot. And so I wanted to ask you about the resources that you really have to deal with that. The President's budget for 2012 asked for a significant increase in the FDA's budget, approximately 33%, which actually includes the new user fees that Mr. Dingell had mentioned, bring it to a total of $4.3 billion. But the Republican budget, as presented by Paul Ryan, we understand would likely roll back FDA funding to the FY 2008 funding levels, which means the agency would be cut by about $600 million. So what I'm concerned about, and my first question is, what effect would a funding cut have on the ability, as specifically as possible, to be able to do its job? How would that affect ordinary consumers, and what would you have to do?
Well, the magnitude of the cut you describe, would be enormously difficult for our agency to absorb without taking, serious cuts in critical programs for the health and safety of the American people with respect to our ability to inspect and support the safety of the food supply, our ability to assure the safety of the drug supply, our ability to approve new and promising medical products for the American people, our ability to protect the safety of the blood supply and other critical FDA-regulated products that people depend on every day. And it would certainly make it very, very hard for us to move forward to more fully and effectively address the challenges of import safety that are being discussed this
And what
morning.
would be your priorities were the increases to go through if the Congress were in fact to give you more money? For example, would we be able to, as Dr. Burgess mentioned, would there be any possibility of speeding up the permits for new pharmaceuticals or new products?
We are trying to target additional resources and additional energy in the area of supporting innovation and really modernizing our regulatory pathways. Dr. Gingrey mentioned the importance of regulatory science, and investments there are making a difference in really moving our systems forward. But a lot of what matters in moving a product swiftly and surely through the regulatory pathway involves having the staff resources to work with the sponsor companies to lay out the expectations for what kinds of data and evidence they need to put forward to support the approval of their product, and to work with them as they are collecting that data, analyzing that data, and presenting it to us. So if we have deep cuts, we will not be able to achieve some of what we know makes a difference in terms of the review teams and what needs to be done. We won't be able to apply advances in science and technology to modernize our regulatory pathways, and we won't be able to do the important work every day, both to ensure the safety and quality of the manufacturing and production of drugs, and the important work to make sure that once those drugs are approved and they're being used by people in the real world, we continue to monitor for the safety and the efficacy of those drugs, so that the American people can actually trust and depend on these important products.
Thank you very much.
Thanks, gentlelady. And next, I think it's Mr. Bilbray. I think Mr. Bilbray is next. Sue Myrick, Ms. Myrick, recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you both for being here. And we do appreciate the work. I know you've got a very difficult job. As was previously mentioned, Dr. Hamburg and you, Mr. Elder, were interviewed on that 60-minute special regarding the threat of counterfeit imported drugs from to the U.S. pharmaceutical supply. Would you mind if we just play the clip so everybody could see?
Products coming into the country with the increase in volume.
The Food and Drug Administration's David Elder told us when they do find a fake drug, they're often forced to ship it back to the sender. On this day, they found pills and vials from India, posing as legitimate thyroid, fertility, and hypertension medications. They had to send it all back.
That sounds crazy. Why not go after this person?
We don't have the authority to actually destroy this on site. This product could very well come back into the country through a different mail facility. Maybe it gets through, maybe it gets stopped.
But they're banking on one of these times you're going to miss.
Yeah. I think they are.
Thank you. It is really frightening, I think, to all of us, because we share your concern. And I know you've already answered the questions that you don't have the authority, et cetera. But in 2009 and 2010, the U.S. Customs and Border Protection seized approximately 2,000 parcels of pharmaceuticals coming through the mail. Do you have any way of knowing how many of those were screened by the FDA or that were destroyed or returned to the sender? Do you have any way to track any of that?
The way the system works is that the products come in to the mail facility. Customs and Border Patrol screens those that look like they contain drugs or medical products, get then targeted to the FDA. We work closely with CBP, of course, and then we undertake the examination of a subset of those products that have been targeted to us through Customs and Border Patrol. And, unfortunately, we cannot screen all of those products because of limited resources, and we do lack the authority when we find violative products to actually detain and destroy them.
And when they return to the sender, I mean, that's kind of the majority of the work that you do. In other words, you can't destroy them, so you have to return them to the sender. Is that correct?
We have a couple of options. We can hold the product and seek support from the courts to destroy them.
But it would be helpful to you if you had some authority from us to be able to do
absolutely something. It would make much more sense in terms of addressing important public health problems and efficient use of resources.
I hear, this is a separate question, I hear a lot from patients and doctors in my area. They have really big concerns about the FDA's risk-benefit analysis. FDA threatens to remove certain drugs and devices from the market that have relatively low risk compared to a patient's risk of death without access to the drugs or devices. And in some cases, we're talking about terminal illnesses, and patients are often willing in that case to take a little extra risk because it means they can live longer. So how does the FDA take these patients into account when it comes to approval and sometimes withdrawing the approval? And can the approach that you use be improved in any way, in your opinion?
Well, it's such an important part of how we think about and use drugs in this country. We obviously do look at the risks and benefits in the context of a given disease and what other treatments are available, and people are willing to accept many more risks if they have a fatal disease and they have no other
So you do
treatment
take
option.
that into account?
So yes, we are in the middle of a process of really trying to make this all more transparent and really systematic and lay out the criteria for weighing risks and benefits in different contexts, both in terms of the understanding that our own staff have about how to think about it and the training, but also so that medical product sponsors and the public, including importantly patients, can understand this as well. And we're doing this in an open way, getting input as we try to shape this model.
I really appreciate it, because it's heartbreaking when you sit with somebody who is using a drug and it has successfully prolonged their life and they're living a normal life, and then the drug is pulled or says that it can't be used for that particular disease. So it presents a big challenge and it just breaks your heart. So I appreciate your looking at it. Thank you. Mr. Chairman, I yield back.
Gentlelady yields back. The gentlelady from the Virgin Islands is recognized for 5 minutes.
Thank you, Mr. Chairman, and welcome, Dr. Hamburg. And I regret that I've been in and out, and I may be repeating some of the questions, but I think it's important for us to understand the implementation of PREDICT. So I have some questions about the PREDICT database, and realizing that it's a new tool that was created to enhance FDA's risk-based screening efforts at ports of entry, and recognizing, of course, that FDA can't inspect every import shipment. This system enables the agency to target shipments that are more likely to violate FDA regulations. So as I understand it now, PREDICT is fully operational for all FDA-regulated products in Los Angeles, New York, Seattle, and San Francisco. Did you say San Juan as well?
Not yet in San Juan. It is being implemented in a staged way, and so components of it, even those 4 sites, aren't as fully fleshed out as they will be over time, but the major components are fully operational and covering 40% of imports out of those 4 districts.
And thank you. And I know that the chairman had asked several questions about the delay, and you said that there were problems. And if you've already specifically stated what those problems are, I apologize, but why specifically, what were the problems that caused the delay in the full deployment of the
Well, as we started to implement the system, it was operating much more slowly than people expected. It was much more cumbersome. And so questions were asked about why that would be. It was initially thought that it was an infrastructure problem, that we were overlaying a very large data management set of tasks onto our existing infrastructure. That was systematically looked at. It actually turned out that the problem was really most focused in a piece of software that interfaced with the PREDICT system that was slowing it down because it was doing a series of initializations underlying the entry process, and that was corrected, and it's now working in a very efficient way, and we are seeing measurable improvements in our ability to quickly move low-risk products through and target high-risk products.
And then you convened a high-level group of FDA officials to identify and fix the problem. Just to clarify, did the problems that you identified with PREDICT cause any risks to the public health or food or drug safety at any time?
Well, I really appreciate that question, because I should emphasize that even when we were having problems with PREDICT, we still had underlying systems that were supporting our screening, and while not as robust and rich as PREDICT, they were still able to provide the core set of public health responsibilities that go with our import screening activity.
Thanks. I think it's important not to make a mountain out of a molehill here. The FDA is implementing a brand new IT system to help keep the food and drug supply safe, and it seems to me the agency is doing exactly the right thing in the right way. No IT system is implemented without problems, but the key is that when you found the problems, you acted rapidly to identify and fix them and to make sure that the public health was not harmed. So we're looking forward to the full implementation. And let's see if I can get another question. And I'd like to ask you about courier fees, because millions of shipments of FDA-regulated products enter the U.S. through express courier facilities like FedEx and UPS every year. And the President, in his budget for 2012, proposes a new international courier fee that would be assessed. So the President's budget requests a new international courier fee not to exceed $5.3 million. What activities would that fee support?
Well, it would enable us to do the kind of review and, when necessary, examination of products coming in through that mechanism. It's a growing component of imported products. It's one that operates on a 24/7 time frame. Because of our limited resources, we haven't been able to target the courier services in the way that would most benefit them. And so actually this is something that I think they're very eager to work with us on in order to support greater deployment of FDA personnel.
So you don't expect that this fee would cause hardships for the couriers and importers, do you?
Pardon me? I think it will benefit them because they very much are committed to very rapid transit of the materials that they're importing, and this will enable FDA to be able to support their business model in terms of transit of products that are safe and low risk.
Thank you. Thank you, Mr. Chairman.
Thank you, gentlelady. The gentleman from California, Mr. Bilbray, is recognized for 5 minutes.
Thank you. Dr. Homburg, I appreciate you being here. In the last 2 years, prior to the new majority being here, how has your budget been impacted by the new administration proportionally from the previous administration? What's your resources? Has the budget been severely reduced, or has it been enhanced to some degree, or what's the deal?
Well, actually, beginning in the last administration, we began to see some significant increases in our budget. So over the last few years, we have had increases in our budget that have been very, very welcome. We do have...
Do you have any idea what kind of percentages you've seen in the last 24 months?
In the last 24 months?
Since you've been there?
Well, we've had... in the last year, it was it's a little hard to...
Okay, but it's been
resolutions and all, but
been a healthy
we
increase.
have had significant increases in the last couple of years.
I appreciate that. I want to get back to this issue that we've got China demanding that research be done in China for drug development, if anything so there. So we're going to see a shift there. We can see a major shift in the emphasis why manufacturing should go to China with this basic extortion game going there. You've got Europe that is really reducing their review of drug and devices to a point way below, basically looks like much more efficient. They're getting more efficient in going out. So we've got this potential of this big increase of imports coming in as we're watching our manufacturing capabilities be exported. Are you reflecting that? Are you planning on that increase in your inspection at the borders? That looks, which everybody in the industry is saying is basically an indication we're seeing across the board?
Let me first address some misperceptions. There is a sense that we are much slower than Europe, our counterparts there, in reviewing drugs and devices. In the drug area, in fact, we went back and looked over the last couple of years, and the majority of new molecular entities, new drugs that both of us approved were approved first in the United States. And in fact, if you look at priority drugs, the number is actually high.
I would like to see that, because the applications were made here first and many a times, and they were basically moved on others because they were perception. But the fact is that from the data we have, and the data I've received basically reflects the fact that even though you had major increases, and I think this is an issue about what do we do with the money, that you had, we're looking at a 28% slowdown of the review of drug processing by FDA at a time your budget was expanding. So there's a lot of these institutional changes that we've got to address, and just sending money across over doesn't necessarily guarantee the job's going to be done efficiently. Or that, not efficiently, but basically the mindset of the bureaucracy does affect timeline and performance, does it not?
Let me just assure you, we take very seriously the timeliness of our reviews, and through the user fee program, we actually negotiate with industry about timelines for performance.
Doctor, let me just say, we've got industry people that we're going to have testify about your operation behind closed screens because they're that scared of the process. But in all fairness, at a time that you had major expansion of resources to get the job done, the numbers that we've got before our committee is a 28% longer period for drugs, a 43% extension of time for devices. That means that just by giving you more money doesn't mean the system's going to run more efficiently. It means
I don't know those numbers, and we'd be delighted to sit down with you and go over the numbers. But I think, the bottom line is that we need to do better. We can do better. Okay. We're working with industry.
Related to this issue, that means we have a vested interest in safety to try to make the system more efficient here as it relies to not just safety and efficiency, but also the timeline. Because that timeline affects the decision of do you produce it in the United States or do you go overseas? And then we, by our own inefficiency here, or lack of reform here in processing, we create a crisis for ourselves to have to review that much more coming in that address this issue. And I hope we have that kind of commitment by your agency that's showing that slowing down the process is not just an issue that makes it safe for the bureaucracy, it's something that makes it more risky for everybody because it may have unintended consequences, such as causing us to have to now import more drugs and have to be reviewing those.
Well, I understand your concerns, and we're very committed. We do take the performance timelines very seriously, and we are meeting the majority of our goals. I'm also systematically reaching out, listening to industry and their concerns. I just met yesterday, most of the day, with a group representing both device and pharmaceutical industry representatives or former representatives to hear more about some of these specific concerns and how we can identify areas to work on together to streamline the process, to help support the need to move critical products into the marketplace.
Okay. I'd just like to ask one last question. Were you consulted about the potential of the device tax that was placed in the bill last year, the potential of that device tax being an incentive to bootleg devices into this country?
I was not.
Okay. Do you have a position on that device tax and its impact?
It's a complex issue. It's not within our jurisdiction, and
I appreciate that. It's just, Mr. Chairman, I think before we do things like device taxes and taxes, we should be asking regulators about how it's going to impact their job. These things are all related. Like I said, it's holistic. You can't do one without impacting the other, and I yield back.
Gentlemen, time has expired. I think we'll go a second round here. As the chairman, I have the prerogative to start, but I'm going to let Dr. Burgess, who has to leave, if he'll take and start on our side. So, Dr. Burgess, you're recognized for 5 minutes.
Thank you, Mr. Chairman. And just on Mr. Bilbray's point about the devices, I can hardly go anywhere and speak to any group without someone pulling me aside. So I'm heartened by the fact that you're hearing some of these same things, but also his point that people are afraid to come forward. When I have someone come and tell me their particular tale of woe about what they've developed and where they are in the process, and I said, well, would you be willing to come to the committee and talk about this? And they said, oh no, I don't want to jeopardize whatever chance I might have now with the FDA. I wouldn't want to put myself out there and jeopardize it. And that's an unfortunate place for us to be. And Mr. Bilbray is also correct. The device tax essentially zapped the research and development budget for many of these small startup companies. We also, in addition to your agency's regulation, we also have the comparative effectiveness, PCORI, the Patient-Centered Outcomes and Research Institute that was funded in the Patient Protection Affordable Care Act. All of these things now interplay with the bringing of new drugs and devices to market. Witness the controversy that has existed over Provenge and Avastin since the first of the year. We've certainly heard a lot about Provenge for prostate cancer and the period of time that it provides for survival is not. It's not cost effective to provide it to prostate cancer patients, but I think there was recently a relaxation of that ruling. Breast cancer with Avastin, some of the same considerations. I also hear people ask me, why can we not talk about surrogate endpoints? It was very effective in developing the drugs that are now useful for treating HIV/AIDS. If survivability is the only endpoint that can be used, and we're not certain how reduction of viral load will affect that survivability in the early days of that, having a surrogate endpoint actually allowed those products to move forward with a great deal more facility and provide relief to a segment of the population that previously had been denied relief. So these are not just abstract issues that we're talking about. They're very real issues. And again, I know that because I can't go anywhere in the country without someone telling me that, I was delayed 4 years with this anti-cancer drug. I'm saving 2,500 people a year now, so I have to assume 10,000 died while I was put on hold by a regulatory agency. I mean, that's pretty severe when we put it in those types of numbers. So I am encouraged that you're considering this, but please also understand that we don't even have the freedom to bring these folks to committee and ask them questions because they're fearful of retaliation from the FDA. Surely you've heard that before.
I can assure you that we make our decisions based on the best available data, not on, other information. They do not need to worry about retaliation. I think what we need to focus on together, though, is to make sure that our regulatory pathways are as well defined and as predictable as possible for sponsors who are bringing new candidates products before us. We need to make sure that we are able to work with them closely so that there's clear understanding of what's expected of them and why. We need to make sure that we're bringing the best possible science to bear in terms of making sure that the data that's being collected in support of a product is the right data, and that, things you just mentioned about surrogate endpoints, we do use surrogate endpoints, but we need to be undertaking a massive effort working with scientists in industry and government to really develop much more innovative clinical trial models that will enable us to get the robust scientific answers we need, but with shorter times, lower cost, and fewer patients, and other areas where we can apply better science to both the drug and medical product development and the review.
And we can't move the goalposts, which is, again, is a frequent criticism that I'm hearing. Let me just ask you a question. When I was talking about heparin in the first round of questioning and the molecule, hypersulfated chondroitin sulfate, am I correct that was actually patented under a Chinese patent?
I don't know the answer to that.
What is the purpose in developing a molecule like that? Does it have a use in industry?
I don't know the answer to that. I'd be happy to get our experts at the agency to provide you with additional information.
Well, it might be something that's useful to know. Again, we're talking about the committee developing legislation to prevent these products from coming into the country. We kind of need to know what was involved and why even develop such a product if it wasn't to cheat somebody who's buying heparin. Thank you. I'll yield back, Mr. Chairman.
The gentlelady from Colorado is recognized in the second round for 5 minutes.
Thank you very much, Mr. Chairman. Dr. Hamburg, how many drug approval applications offhand, do you know offhand, does the FDA get in a year? Do you know offhand?
Let me see if one of my other experts know. I don't know offhand, but that's easy information for us to actually get.
And you're, well, the reason I'm asking the question is because I know that the FDA is working on trying to streamline the approval process, but at the same time making sure that the process for each new drug is thorough, correct?
Right.
If we have a large budget cut to the FDA in the next year's budget, is that going to help or hurt our ability to expedite the drug approval process?
Well, unfortunately, it will clearly hinder our ability, and we are talking very large numbers, especially if you look at the drug and the device side. And as we've been talking about already, the ability to really support sponsors in their efforts to bring products before us does require, it's a resource-intensive, staff-intensive activity to be able to provide the best possible and the most timely review.
And you can streamline processes, and I assume you're doing that, but at some point it does take the resources to pay for the staff to review the applications and to do what needs to be done. Is that right?
That's correct.
A second question I have is this discussion that a lot of folks have been having in this hearing about the approval process resulting in a slow and more cumbersome process than in the EU. And I hear this a lot, and I've read it a lot in the media. I'm wondering, I don't think you got to fully explain what the FDA found when they looked at this claim that the EU is much more fast and efficient and does a better job. I'm wondering if you could just finish your answer to that question.
Okay. We did take a very serious look at the exact numbers because we were hearing more and more questions raised in this area, and what we found was very striking. I may get the numbers slightly wrong because I didn't review them before coming to this hearing. I was more focused on the import safety issues, but I believe that between 2006 and 2010, if you look at, there were about 53 or 54 new molecular entities that were approved by both the EU and the U.S., and that we were, in fact, significantly more rapid in approving those drugs in, well over 50%. I think it was 43 or so of those products. If you actually look at cancer drugs, and the time frame that we looked at for that was a little different. I think it was 2003 to 2010, but there were 23 new cancer drugs that were approved by both entities, and that we were first in approving those. So, there clearly is a misperception that we are slower than our counterparts in the European Union, and for the priority drugs, we were very significantly, we were almost twice as fast in approving these drugs.
Was this a study that you did?
It was a systematic review.
If you have data from that, I'd like it if
better.
you could submit.
I fear I probably should not have even tried to give numbers because
if you could supplement your testimony with that today, that'd be great.
Okay.
And I just have a couple more questions. One is we've been talking about this terrible adulterated heparin. So I guess my view would be under this Drug Safety Enhancement Act, with which Mr. Dingle and some of us introduced yesterday, would that give the FDA new authorities to address issues like intentional economic adulteration, like in the heparin situation?
I think it could very well give us important authorities that would make a difference. Additional authorities to, really pursue investigations in places outside of our borders when there are public health concerns, our ability to share information with counterpart regulatory authorities so that we can get a richer understanding of potential or emerging threats. Those would certainly make a difference, and I think that enhanced civil and criminal penalties could reduce the attractiveness of pursuing some of these kinds of nefarious activities as well.
Thank you. Thank you, Mr. Chairman.
Thank you. Dr. Hamburg, You know, I'm just sort of curious about these 150 countries that import food and drugs to us. If you don't mind, you could send us a list of those countries. That would be helpful. And just going to your website and pulling up the website, I noticed that just for this year, it lists countries that there have been alerts on. For example, Bangladesh had 10 alerts. Cambodia had 1. Indonesia, there was 27 alerts. The Ivory Coast, considering what's going on there, had 3. Nicaragua had 9. Thailand had 47. And Zimbabwe had 1. Do you have the authority to stop all when there's a, so we say, a huge turmoil, a war, a revolution, civil war that's going on over there? Can you stop imports from those countries, considering the danger coming?
Well, our import alerts are based on public health risks, but certainly they are targeted to
Can you stop,
events in the
can you
world.
immediately, do you have the authority to stop, for example, from Thailand, where there's unrest and they had 47 alerts? Isn't that enough to say you're going to stop altogether?
Well, I think, you know, important and timely example is
Do you have the
Japan,
authority? Do you have the authority to do that? To
we
stop?
do an import alert based
yes or
on
no?
a public health.
I just like to know,
threat.
yes or no. Do you have the authority to stop? For example, the Ivory Coast had 3 alerts this year. Do you have the authority to stop all imports from them?
No, we would have to be able to show that there was reason to believe that a product or set of products was violated.
But if you had an alert in Ivory Coast of 3 and Indonesia of 27, isn't that enough to suddenly, especially if there's a
those
civil
are
war?
for particular products where there are concerns.
So you don't have the
associated
authority.
with
You've
those
got to
products.
identify the risk in detail before you do that. Otherwise, you don't have the authority.
Right. We don't do blanket restrictions based on circumstances within a country.
Okay. Mr. Bilbray had talked about a little bit about the budget. Do you? And I mentioned it earlier that your budget went up by $107 million. Did you know that?
We have, as I said, had very significant increases in our budget in the last couple of years. It's made a difference. I think it's important to recognize, though, that we have been under-resourced for literally decades.
But you understand the budget has gone up for this fiscal year.
I do,
okay.
and I've been very appreciative of
But as I understand, when you were talking to Mr. Bilbray, you weren't sure clearly what the percent the budget's gone up, and you weren't really clear what your budget numbers. Is that correct? That you weren't quite clear on that?
This has been an unusual budget period. He was asking me what the budget increase in the last, did he say 24 months?
Yeah.
A few years.
But I think what you...
But we certainly do have that information.
So you don't really know your budget numbers at this point. You don't know what they've gone up. Is that correct?
Well, we're still looking forward to learning our budget numbers for this year.
Okay. We have a chart here that has come from you folks, FY 2010 ORA Field Workplace. I just want to show you this, and staff has given it to you. If you go down to the 5th line, I know President Obama has talked about food safety being one of his top priorities, and he has indicated that it's very important for the administration. Yet when you look at import foods in general on this line in the work plan for FTEs, which I understand FTEs are basically the federal equivalent, federal time equivalents, which are not people but are just blockouts. It appears to me that in 2009 to 2010, 2009 was the Bush administration, and 2010 was the Obama administration. It actually is going down in terms of the work power that has actually been extended and enforced on import foods. Is that correct? That it's a little surprising, considering the priorities and particularly what you've talked about, to think that the man hours are actually in this area has gone down. And I just want to explain why has it gone down.
I'm going to let my colleague, Mr. Elder, respond. This is a very specific question of a line. It's less than one full-time equivalent person.
But at the same time, Dr. Hamburg,
I will let him.
The imports have increased, so the figure is not to say that, but the point is with the increase of the imports, and yet your manpower has gone down on this is just a little puzzling. Yes, Mr. Elder, you're welcome to take the mic. Is it turned on?
I believe it is, Mr. Chairman. Thank you.
Yeah.
The highlighted decrease involves one particular program within our overall foods program. It is what we call Program Assignment Code 03819A and B. It's import foods in general. It does reflect a 0.7 FTE decrease from the previous year. It is not the only program, however, in which we cover imported foods. You can see that imported seafood products were raised by 7 FTEs in the fiscal year. There was an overall increase of 61 FTEs.
But Mr. Elder, you would agree that that's the biggest program you have. When you look at all the other figures, it's multiples of all the other programs. So I think you're sort of discounting a program in which it is the top program. And to see the top program actually in man hours go down in terms of the FDA's work plan is a little quite startling.
I think that Mr. Elder was indicating, though, that this is just one component of our overall import safety program for foods, and that program has actually expanded.
But wouldn't you agree, Dr. Hamburg, that all these things should have a positive? They should not have a negative? I mean,
well, I think we want to make sure that we're deploying our resources in the most responsible and efficient way possible.
Well, I would think import foods is one of your most highest priorities.
No, but I think we need to also look at the overall program and how individuals are being deployed. And this does not mean that the overall food import program has decreased. In fact, it has increased in terms of...
Well, I would say that your workplace changes that you show does not show that increase, rather it shows that it decreased. So my time has expired. The gentleman from Michigan is recognized for 5 minutes.
Dr. Hamburg, you have, in response to a question from Ms. DeGette, said that review times in U.S. and Europe vary, and that FDA is faster in reviewing drugs. We've also been hearing that Europe is 2 years faster in clearing devices than our FDA. Is that statement true, and if so, why?
You know, first of all, it's not a competition, and we obviously have different regulatory frameworks. But when you look at the numbers in both drugs and devices, the lag times are not what has been put forward. In fact, in the drug area, as I said, you know, there have been, in key areas, we clearly have approved critical products more swiftly. The device system in Europe is quite different than that here.
So
but we are not.
It's a difference in what is done over there as opposed to what
they do. They have a very different approach to device review, and it's also.
Would you submit to us a statement as to why that is so, please, for the record?
We'd be happy to, in the numbers that are available about comparative time.
Thank you, Doctor. I want to get now to some other things. I'd like to come back to the new authorities given FDA and the Food Safety Modernization Act and how they're going to make the food supply and imported food safer. Is that statute working, and do you have the authorities now you need? Do you need new authorities, or do you need new money?
We're obviously very early in the implementation of this historic piece of legislation, but we are making good progress, and we can see that it will very significantly strengthen our ability to protect the safety of the food supply, to be able to really shift to a preventive approach, and to work in greater partnership with our state and local partners, with foreign governments, and with industry, clearly in terms of being able to implement all of the requirements, and there are many in that Food Safety Modernization Act. You know, we again face the resource limitation issue, and we're hoping to be able to work with Congress on user
problem. I remember, Doctor, that when one of your predecessors, Frank Young, for whom I had great respect and still do, used to call me up and say, "John, we're going to move this situation forward. We're doing a real fine job, and we have a great new plan, and we're going to do this without new money." And I said, "Frank, that's a lot of hooey." And a couple of days later, he'd call me up and say, "Well, John, we just can't do it because we don't have the money for this." And this brings us back to the question of registration fees. The House bill, as it came out of this committee, had registration fees in it, with the support of the industry, which still supports that idea. It was taken out in the Senate. So user fees in that regard, both with regard to food and with regard to pharmaceuticals, would ease your financial stresses and strains, would it not?
We clearly cannot fully implement this bill without additional resources.
Now, did the food, and this question I ask again, well, the other thing I remember that is very troublesome to me is we had a movie before this subcommittee one time when I was chairman, and it showed a bunch of stuff coming into this country, mostly pharmaceuticals and things of that kind. And by the Great Horn Spoon, most of these pharmaceuticals were unsafe, misbranded, counterfeit, and some of them, believe it or not, were controlled substances. And they were just coming in through the mails. Everybody was sort of waving at them as they went by. And I see you confronting the same problem. I'd be willing to bet if somebody were to put movies down there at some of the points where these things are imported, we'd find the same situation going on. Now, this situation happened to relate to the center at Miami where they were coming in. And so I think that something here has to be done. And Mr. Chairman, I just want you to know that I appreciate your holding this hearing. It's my hope that we can work in a bipartisan fashion to put together a bill. This committee can move out, us all working together as we have done in the past. It makes great good sense. It is something that the public needs. Americans are being killed either by bad stuff coming into this country that poisons them or makes them sick, or they're being killed by being denied workable and worthwhile treatments and pharmaceuticals because people are sending in things like chalk and sugar as part of the medicines that we're receiving. So I want to commend you and thank you for the hearing and hope that as we go forward, we'll be able to use this hearing as the beginning of an honest effort to work together to do something that we can do by working together. And I think it's a lot better than quibbling about whether we've got Democratic or Republican witnesses, because that's not really important. I'll be happy to take credit for the presence of Dr. Hamburg, and I'm sure you would too, and not to quibble about whether she's a Republican or a Democratic witness. So I commend you, Mr. Chairman, for your leadership in this matter. I thank you for your recognizing me, and I again appreciate the opportunity to start moving forward on something that's in the public interest. Thank you.
I thank the distinguished emeritus chairman of the Energy and Commerce Committee, past, and I appreciate his past leadership and his spirit of bipartisanship to continually reach out, and I think it's a good example for all of us to remember in this process. Dr. Hamburg, I want to thank you very much for your forbearance and patience for this hearing. All members have 10 days in which to submit any extraneous material they'd like to, and with that, the subcommittee is adjourned.